Welcome to my lecture series on bad science in the news. In this talk, I will be discussing the case of alcohol and health. Now, I like beer. I drink beer. It's something I enjoy, and I think that's okay because, well, it tastes good. It's something I do with my friends, and it's healthy, right? I think it's healthy. Well, I did find this news article in the Telegraph which talks about the surprising health perks of drinking beer. And there are a lot of interesting claims here, claims that I certainly like to read. Let's see, drinking beer can reduce the incidence of heart attack. Okay, that's good. It can cut the risk of strokes. Also good. It can reduce the risk of developing type 2 diabetes. Check. Can improve eyesight. All right, I like that. And it can even help people lose weight. These are interesting statements, and they all have something in common. They seem to suggest a causal relationship. They seem to suggest that drinking beer causes good health. And the reason for that effect is due to a number of intermediate or mediating variables. So drinking beer causes good cholesterol, healthy blood vessels, and reduced inflammation, and then those specific health benefits are what cause better health. But is it really the case that drinking beer causes those intermediate variables? Maybe it is. I found one study that said most alcohol types could have protective effects against heart disease and diabetes, with the strongest effects occurring for craft beer and wine. Wait a second. Craft beer and wine, isn't that what wealthy people, what rich people tend to drink? So there's this concept of socioeconomic advantage. The idea is that some people have more wealth. They have access to money and a lot of the things that money brings, things like access to social services and healthcare, right? Well, it may also be that people with socioeconomic advantage tend to drink certain types of alcohol. That makes sense. Now, there's also research showing that people with socioeconomic advantage, things like better education, more income, have better health. All right, so I think we're starting to see something interesting here. Socioeconomic advantage causes certain types of drinking, and it also causes better health. If that's the case, then the relationship between those certain types of drinking and better health is probably spurious. In other words, yeah, they are related, but they're only related because they are both caused by socioeconomic advantage. So how can spurious relationships be identified and adjusted for? Well, there's one approach that scientists use, and that's to conduct statistical control. Statistical control is the measurement and analysis of the special causes of a phenomenon. By first accounting for those special causes, which are also called confounders, the effects of other causes can be shown. A purely spurious effect will be reduced to zero when controlling for confounders. And so on the previous slide, what we saw was that socioeconomic advantage might be a confounder. It might explain both particular types of drinking and good health, thereby explaining why drinking and health are related. And this is something researchers have looked at. Studies have suggested that inadequate adjustment for confounders, particularly socioeconomic status, which is basically the same thing as socioeconomic advantage, may account for some of the erroneous conclusions that drinking is good for health. Accounting for such factors as socioeconomic advantage decreases the strength of association between moderate drinking and mortality. Okay, good. So it decreases the association. It suggests that maybe that relationship is at least partly spurious, but it doesn't entirely address whether or not it is spurious. Really addressing the spuriousness probably requires conducting randomized controlled trials, looking at clinical endpoints. What does that mean? Well, it means conducting experiments. So experiments involve the systematic variation of a suspected causal factor and the measurement of the outcome of interest. If the only difference between experimental conditions is with respect to the causal factor, then it is reasonable to conclude that observed differences in the outcome were caused by the causal factor. Now, I'll give you an example of how an experiment could be conducted to examine the relationship between alcohol and health and whether indeed it is causal or spurious. So you would take a group of people, a generalizable group of public, and randomly assign them to two groups. One group would drink a glass of wine every day. The other group would drink a glass of grape juice every day. Oh, hold that thought. Maybe they shouldn't drink grape juice. Grape juice has sugar in it. And I think we all know that high amounts of sugar are bad for health. Might as well take sugar out of the equation as much as possible. Instead of grape juice, let's just take some wine and remove the alcohol. There's got to be some way to evaporate it, right? So then the only difference between the two groups is that one is drinking normal wine with 15% alcohol. The other one is drinking, well, not normal wine. It's different because it doesn't contain any alcohol. And so these two randomly assigned groups of people will drink that glass of wine or non-alcoholic wine every day for 3 months. And then at the end, the researchers would make some observations about health outcomes. Take blood samples, urine samples, some sort of physical tests, all different ways of measuring health. And if at the end of those 3 months, the group that drank the alcohol has better health than the group that didn't drink alcohol, it would be reasonable to conclude that the alcohol caused better health. But you really need to do this type of study, and you need to do it well in order to draw those types of causal conclusions. And in fact, researchers have done this type of study. In one research project, there were participants who had type 2 diabetes who are non-drinkers, so they weren't already drinking, and half of them were assigned to drink wine every day for 3 months. The other half were assigned to drink non-alcoholic beer for 3 months. At the end of the 3 months, those who had been drinking the wine had healthier blood sugar levels. And so, at least with respect to their fasting glucose levels, wine had positive health effects. Okay, so there is some evidence that drinking alcohol is good for health, but it has to be done in this particular way to be certain about the cause and effect. And so, really, what is the difference then between correlation and causation? Researchers have come up with a number of different criteria for evaluating whether one thing causes another, and most of these criteria tend to converge on 3 factors. First, there needs to be an observed association. So what is thought to be the cause needs to be correlated with what is thought to be the effect. They need to co-occur. When one is observed, the other tends to be observed. Okay, good, that's the first. There needs to be temporal priority of the cause with respect to the effect. In other words, the cause needs to happen in time previous to the effect. And then third, the relationship should not be explained by some additional confounder or a third variable, because that would suggest the effect is spurious. So the variables need to be related, there needs to be temporal priority of the cause, and the effect can't be spurious. Now, this is something that randomized controlled trials or experiments do quite well. They are able to show the relationship between two variables. They're able to show through making manipulations at the beginning of the study and making observations at the end of the study that the cause was temporally before the effect. And then they can carefully control the conditions of the experiment to rule out spurious explanations. Experimentation really is the gold standard of determining causation. And this is something important that sometimes news reports overlook when making causal claims. Often it's the case that news reports claim causation when the study that they're reporting about only showed correlation. So this is both a challenge of researchers for communicating with journalists about the nature of their findings, but then also journalists really being aware and familiar with what differentiates correlation versus causation. So when they claim that alcohol is good for health, they are referring to the results of experiments. But there is, of course, a broad social and institutional process that really affects how bad science or bad science reporting gets in the public. And in fact, why do scientists in the media sometimes allow bad science to propagate? Join me in my talk where I discuss how bad science makes it into the public view, and you will learn more about that. If you're curious about any of the studies I reported on or cited in this lecture, the links are in the description. Thank you for watching.